Jordan and Davey on NCIFM, Legendary Country, and more.
Good morning, 7 minutes after 9 on our NCI lines. Joining us this morning, Dr. Anderson. Thanks again for checking in with us on a Monday.
Good morning, and thanks for having me again.
All right, in the house, we got Davey Gott and also Garth Hilderman for your COVID-19 update here. Let's chat numbers overall because they have been climbing, especially over this weekend.
Yeah, we did see some higher numbers over the weekend, 183 new cases in the province on Saturday and 170 new cases announced yesterday. Province-wide, the test positivity is at 5.6%. And then if we talk about the north specifically, yesterday, 36 new cases. And, you know, out of the 16 patients in the ICU that are considered infectious, we'll just note that 5 of those are from the north. And the north also has 14 people in hospital right now with COVID during their infectious period out of 61 in the province as a whole. So things certainly continue to be concerning. What we've seen in the past is that when case numbers rise, hospitalizations tend to rise, 10 to 14 days later. So I think we're all trying to prepare for that and really feeling that we're in that race between getting as many needles in arms as possible before, the third wave gets worse.
Let's talk about getting needles into arms then, because I think we're a little under a quarter of all adult Manitobans being vaccinated, and, every jab is one closer towards the goal, I suppose. Are we seeing better uptake rates in some communities in the north where it had been hit rather hard recently?
Yeah, the uptake is hard to comment on right now, I'll just say, because of the way FIMS works for First Nations communities. Most of them don't have the ability to directly enter into FIMS. So we have those extra steps of, needing to collect the paper forms, send them off somewhere where they can be inputted, and then it gets inputted into FIMS and we can report on it. So hard to say for sure. I will say that the numbers are going up, and anecdotally what we are hearing is that the vaccine doses are getting administered more right in the community, whereas, when we first started this rollout, there was maybe some slower uptake and people concerned about safety. As time has gone along, we've actually seen very, very few serious safety concerns in Manitoba as a whole, including in First Nations communities. And so as people see how safe the vaccine is, they see their relatives or community members getting the vaccine and not having serious side effects. And then, we're also constantly doing this risk assessment about the risk of side effects with the risk of COVID and the third wave worsening. So just one other point on this is as we're starting to get ready to send second doses out to First Nations communities, what we're hearing from some of those communities is now we have more people who want to get their first doses. And that's great. And we'll certainly be sending enough vaccine for that as well.
Now, side effects, blood clots, the top headline pretty much anywhere you happen to go here. Despite relatively low numbers, there's a ton of vaccine hesitancy out there. What can you tell people to kind of get them over that? Like any sort of drug we take has a potential. I think we just know more about it here, and it's causing some issues. What could you tell us that might put some minds to ease?
Yeah, so I would remind folks that it's a very serious side effect, the blood clots that have been associated with AstraZeneca and with Johnson & Johnson in the U.S., but it's incredibly rare, like under 10, despite millions and millions of doses being administered. So we're talking about in the neighborhood of somewhere between 1 in 250,000 and 1 in a million chance of getting a blood clot. Or getting the vaccine-induced thrombotic thrombocytopenia is the official name. So it's an incredibly rare, though serious side effect, whereas realistically, your chances of getting COVID and then ending up in the hospital or having a serious outcome due to COVID, if you're in that same age bracket, is much higher than that. And so even with this very rare but serious side effect, the risk of getting the vaccine continues to be much, much lower than the benefit that it offers of protecting against COVID. And then the other point that I think is really important for people to understand is AstraZeneca and Johnson & Johnson are still overall very safe products given their rare effects, but they're a different type of vaccine entirely from the mRNA vaccines, Moderna and Pfizer. And millions and millions and millions of doses of Moderna and Pfizer have been administered worldwide without the same blood clot complication. So we have overall very safe vaccines, but just to remind people that those Moderna and Pfizer vaccines have not been associated with that rare but serious side effect.
I know with, like Garth mentioned, with any kind of drug, there is side effects. You think of those commercials on television, and then they say this is for, say, heartburn, and then they list a slew of things that could possibly be a side effect, right? And most people are absolutely fine. So this is just the same kind of thing, just we're hearing about it every day. So I think it heightens the fear.
Yeah, and it heightens the fear. And without comparisons, it is hard to understand what the real risk of it is, right? And so people are probably seeing those memes floating around that compare the risk of these blood clots after AstraZeneca or Johnson & Johnson with the risk of blood clots with air travel, or if you're on other medications like birth control pills that can contribute to blood clots, or if people smoke. And the risk of blood clots with these vaccines is much, much lower than the risk in those other situations. And even in those situations, it's relatively rare, right? And lots of people fly, certainly not during the pandemic, but during normal times without really thinking about the risk of blood clots at all. So I think it's really important that we be aware of these potentially serious side effects, but also that we're aware how rare they actually are and how they factor into that individual or even the population risk-benefit consideration.
Now, on that, I think there's a lot of frustration out there from people that are kind of on board with the whole risk assessment thing, and I think I would put myself into this group. I look at it as I have a 249,999 out of 25,000 or 250,000 chance of not having a blood clot. I'm willing to go and get that AstraZeneca vaccine, but I'm not allowed to because I'm not old enough. And it sounds like Alberta and Ontario are going to go against NACI's recommendations that it only be 55 and up that get this and open it up to people age 40 and up. And that would include me. And I kind of wish I was able to do that. Is Manitoba looking at going against NACI on that just to get that out there? Because some of those AZ vaccines, they're just sitting in pharmacies and doctors' offices because there is that hesitancy from the target groups to sort of take the vaccine. Are we looking at expanding that?
I would say the vaccine task force and the medical experts are continually reviewing the evidence as well as what other jurisdictions are doing. I do recall seeing a story late last week that said NACI makes recommendations, Health Canada issues the approvals, and so that is why some of the provinces are starting to change the age groups. Might not be exactly what NACI recommends, but it is still approved or allowed under Health Canada. And again, those risk-benefit calculations are so important. I think if we look across the country and certainly to our neighbors to the east, what health professionals are consistently saying is the best vaccine for you is the first one that's available for you. So like you said, would encourage people to continue to look at the vaccine eligibility page on the Government of Manitoba website, to pay attention to the news if that changes, and like you've said, to really at that individual level consider what the benefits are of getting vaccinated as soon as possible compared to the risk of this very rare side effect.
Yours truly actually just got a Moderna vaccine. I had a question here.
Sure.
How long before I get the full, the Moderna vaccine doesn't offer the full vaccination thing there, but how long will it take to go into effect? Because I know you couldn't possibly get the full effect of the first vaccine the day after. How many days does it take for that vaccination percentage to kick in?
Yeah, usually about 2 weeks is what we would say. After 2 weeks, you start to have some protection, and of course, that protection is best after both doses. And so we're so confident in these vaccines that 2 weeks after you get your second dose, For example, if you were named a close contact after an exposure, you wouldn't have to isolate, and that's one of the benefits. They're so effective, they start to change isolation requirements 2 weeks after both doses.
Is there been any research as well? Because I know that when I was getting the vaccine, there was some questions I was rumbling around here. Can you get a second vaccine? Say if I got the Moderna a little later down the road, can I get the Pfizer?
So for now, it's still not really clear when it comes to that first and second dose series. So we're trying to do same vaccine really wherever possible. In the future, when we start to look at booster doses, which there's starting to be some more discussion of timing around booster doses, likely there will be more flexibility in the type of vaccine for the booster dose, but really no firm evidence or guidelines yet.
All right. Anything else we need to cover? Oh,
I did have something. The CDC recently announced the risk of spreading the virus on surfaces is low, and it was suggesting we don't have to wipe things down like we've been doing. What do you think? What are your thoughts on that?
So my thoughts on this are that we're at the start of the third wave in Manitoba. We saw concerning case numbers over the weekend. We do not have anything close to herd immunity yet in the province as a whole, and so we need to continue to be extremely diligent. And I would just be concerned that if people thought that surfaces were less of a risk and they could pull back on being as careful around the surfaces, that they might also be less careful around other things. And we really don't want that right now. We need people to be stepping up with their mask wearing, with their hand hygiene, with their physical distancing, and with every precautionary measure that they can take as we continue to roll out the vaccines and try to keep our third wave as low as possible. So I would say let's continue on, and if anything, let's step up our efforts with all the public health measures we have available to us.
Well, we thank you for everything that you're doing, and you keep being on as strong as you are. Thank you so much for joining us, Dr. Marcia Anderson.
Thank you, and have a good day, everybody.
Ekosi.
Jordan and Davey on NCIFM, Legendary Country, and more.
Good morning, 7.